go. Why am I struggling to find a surgeon in the UK to see me following going abroad for surgery? Good question. We get a lot of this. Oh, got a lot of it. And I got to be honest with you, I feel bad. I do. I feel bad. The problem is that if you have cosmetic surgery, plastic surgery, the way it's structured is different to other kinds of surgery. It's different than if you're having a hysterectomy or a hip replacement or a cataract or a hernia repair, because cosmetic surgery has a pricing structure which involves a fixed price package. I've been thinking about this a lot, and I think this is the nubbins of what it comes down to. If you have another kind of surgery, particularly if you're insured, your insurance company will pay for you to have that surgery, the hysterectomy, the hernia, whatever. If you then need to see and they'll often have 2 or 3, or they'll have 2 outpatient appointments or something included, which are all included. But those 2 outpatient appointments, the surgeon will get paid for by the insurance company. Your insurance company will cover a certain amount of the problems. But if you have a problem, if you have to go back to theatre, if you have to have a revision, if you're not happy with the way things look, or if you've got an issue and you need further surgery, the insurance company will pay for that. The surgeon will get paid for that. The surgeon gets paid for every time you have an operation. So, in terms of the income, as plastic surgeons, people often look at us and see how much we get paid for an operation, think, wow, you get paid loads of money for an operation. I don't get paid, anywhere near that amount for my operations. I feel like saying, yeah, but we only get paid for that one operation. That includes looking after this patient and making sure it's all right. That includes making sure that you see them in clinic. That includes making sure that if you need to do any revision surgery, you do that revision surgery and you don't charge. And that's part of the fixed price package. The hospital doesn't charge, the anaesthetist doesn't charge, and the surgeon doesn't charge if you need a revision of your surgery. And that is all included in the price. So if you go abroad and have surgery and then you come back a week or a month later and you're not happy with the results of the surgery, the amount you have paid when you've gone abroad has included the aftercare. That is part of the amount that you've paid. You have paid for the aftercare abroad. And you can't just then ring up and someone local and say, can I, I'm not happy with the result. I had it last week or last month or 3 months ago, and it's all gone, doesn't look right. You're going to struggle to find a surgeon to take you on, because we don't really have a structure where we can just take people on for the aftercare. We don't have a price where you say, okay, come and it'll be £15,000, please, and I'll see you in the clinic. We just have we just have prices for the operations, and it's often more difficult, to do revision surgery. It's often you don't know what the original surgeon's done. There's scar tissue involved. You're obviously already unhappy, so you're kind of on a back foot. So it's a difficult world to be in, and one that I think many surgeons, myself included, don't really relish the thought of taking on problems of surgery that may or may not have been done in a not great way. And it's just really hard fixing problems. And it sounds really unhelpful to someone asking for help, but the honest answer is it's much better to do it right first time. I mean, I know that's unhelpful once you've had it all gone bad, but you got to kind of question why there's such a range of prices for procedures. Often people say, there's no way I'm paying that. I'm going to go to Turkey, or I'm going to go here or there because it's a fraction of the price. You're ripping me off, man. And you're like, yeah, I know it's a fraction of the price at other places. I don't know why. You've got to ask yourself why. And maybe it's because there's a difference in terms of how well they perform their aftercare and revision, etc. And maybe that's why it's more expensive here. And so you can't kind of then pay the fraction of the price and then say, actually, you know what, can I get it done here? Well, no, because all the people that I treat have paid the price that I've charged, and my duty is to look after them and make sure they're right. And I don't really want to take on other people's issues and problems, because that's their duty, that's their problem. And I think we've got, So I don't want to run into the next question. Don't want to cannibalize my own questions, but that's the nubbins of it. We don't have a structure where you get paid, you know, X for the surgery, and then you get paid for each consultation. If you have another surgery, get paid again. You know, the amount you pay for the surgery is inflated because it includes the aftercare. We don't really have a pay-as-you-go structure for cosmetic surgery. We have a one price which includes all of the aftercare in it, and we don't really have a price for just the aftercare. So that's the sort of logistics behind it. But the emotional side of it is always difficult surgery, and it's always you know, it's always difficult getting involved with someone else's you know, problem.